My name is Jan Apelqvist. I'm an associate professor at the Department of Endocrinology, University of Skåne in Malmö city. I am a specialist in internal medicine, and I'm profiled in treating and preventing diabetes-related complications in the lower extremity, particularly diabetic foot ulcer. I am responsible for what you call an interdisciplinary foot center, who is actually incorporating 14 different disciplines with regard to prevention and management of diabetes. I've also been working internationally for many years in collaboration with EWMA, in which I'm a previous president, and also were a member of the editorial board of International Work Group with Diabetic Foot. The history why I became involved was almost 40 years ago, since at my hospital suddenly the Department of Orthopedic Surgery realized that there was a need to do something to prevent diabetes-related amputations. And from that started a process to identify which people got the problem, could it be treated, and on that day suddenly and slowly a process started to build up interdisciplinary teams. And that led to a development of various kinds of research projects, and it ended off also that it was possible to prove that actually you can prevent diabetes-related amputation. You need to be interdisciplinary, and it can also be cost-effective if you actually use the common treatment. The problem today with the diabetic foot also illustrates also the problem in other categories of individuals with chronic ulcers. And that is actually that most of the patients do not get access to a structured treatment management program where they actually take care of all the factors that prevent healing in the individual, both regarding to the concurrent disease, regarding the lower extremity, and also the ulcer per se. The reason for that mostly is that actually they frequently don't exist a discipline that is focused on the problem. And that means that the patients are in a situation what we call fragmented care. That means that they have to be cross-referred or they get stuck in the system because they can't get access to the competence, skills and technologies that actually are available. And that is also illustrating that why the European Commission actually put up the diabetic foot ulcer, for example, as a model why we need to change the healthcare system to be more process-oriented and also focused on patients of elderly age, ulcers and with multi-organ disease. And that means also that we need to take care of another way to look at health economy. Instead of talking cost in terms of expenses, we have to talk about resource utilization, where we introduce new technologies, new management strategies, in the end that will actually reduce cost by improving the clinical results. So today we have to talk about much more of a result-oriented management regarding organization and economy. The problem we see in Western world today is another, and that is actually that a large generation of caretakers, physicians, nurses and other categories are going into retirement. That means that the challenge is not only economical, not only regarding health economic organization, but also regarding the access to competence and skills. As a consequence, it is needed to introduce educational programs, structured management programs to increase the awareness and also the skills and access to treatment. We have to work together to do that. It's achievable and we can make a difference.